Hello, everyone. Thank you so much for joining us tonight. Welcome to Unlocking JACR Opportunities for Radiology Trainees. I'm very excited to moderate this panel discussion tonight. I'm very fortunate to have with me a group of distinguished panelists and leaders in the field join us tonight as we delve into ways trainees can get involved with the publishing powerhouse that is the JACR. My name is Bart Sheppa. I'm a current radiology resident at Tufts Medical Center in Boston. I'm on the executive committee of the ACR Resident and Fellow section as the education liaison, and I'll be moderating tonight's discussion. The first of our panelists is Dr. Amy Patel. She is a board-certified radiologist who specializes in breast imaging. She's the medical director of the Breast Care Center at Liberty Hospital and associate professor of radiology at the University of Missouri, Kansas City School of Medicine. She's also the associate editor of digital media for the JACR. Dr. Miles is an associate professor at the University of Colorado. He serves as the chief of breast imaging and associate director for research and radiology at Denver Health, with oversight over the breast division's clinical, research, and educational programs. Dr. Miles' clinical research and public health efforts center around using innovative techniques to identify barriers to breast cancer screening, create patient-centered initiatives to improve access to breast imaging services, and examine how to improve delivery of high-quality, guideline-centered, concordant breast care for all patients. He is an assistant editor of the JACR, past JACR Hillman Fellow, and current host of the JACR Case webinar series focused on care in community and safety net environments. Maddie Wolfeck is a private practice radiologist in her second year of practice. After completing her cardiothoracic fellowship at Duke University, she now works remotely from Charleston, South Carolina for Radiology Partners. During residency, she was on the JACR Trainee Editorial Board, published multiple articles and editorials in the JACR, and also won multiple JACR Exceptional Reviewer Awards. She is a current ACR Hillman Fellow along with Dr. Fatima Ilahi, and she currently started the new podcast, Radiology Today, with the JACR, which you can catch on Apple Podcasts or Spotify. Finally, after today's panel, we'll be graced with a presentation by our very own Dr. Ilahi. Dr. Fatima Ilahi is the chair of the Resident and Fellow section of the American College of Radiology. Dr. Ilahi was a recipient of the Bruce J. Hillman Fellowship in Scholarly Publishing awarded by the JACR this year. She's currently completing her breast imaging fellowship at the Mayo Clinic in Rochester, Minnesota. Great. So now that everyone has gotten to know all of our wonderful panelists tonight, I'm going to go ahead and throw some questions out to the group. Feel free to answer any question that you want, anything you feel particularly inclined to. And I want to hear multiple perspectives on these questions. So even if you feel like the question has already been answered, please don't hesitate to throw something in. So for the group, how did you get started as a Hillman Fellow? What was your experience as a Hillman Fellow like? What opportunities did it afford you? What surprised you about the fellowship?
I'm happy to start with that one. So the Hillman Fellowship is something that I had really had my eye on since residency and really worked towards that goal. And the first step for me was the Trainee Editorial Board, which I found very helpful. It gave me the first insight into the journal. I got to meet Ruth Carlos and Christoph Lee that way. I got assigned a mentor from the JACR Editorial Board. It was very influential in my decision to continue to pursue the Hillman. This past year, being a Hillman Fellow, I was able to go to New York with Fatima, and we were able to spend some time at Elsevier, which is the journal publisher. And we learned everything with the background of the journal, from the reviewing process, copywriting or copy editing, the publishing portion, everything, all of the background information about it, which was really, really helpful, and maybe even that much more interested to remain involved and get even more involved. But yeah, certainly the Trainee Editorial Board was the first step towards that. Also getting to know people like Abby and Lindsay, who are behind the scenes, but are just as important as everybody on the board, who are very influential with the digital media and the publishing. And then finally, the most important thing that I got from this was being able to start the podcast, which I have really enjoyed. I've always wanted to be able to deep dive into the articles in the JACR even more. It allows me to just cold email the authors and ask to talk to them about their work, which has been really exciting and interesting for me, and able to answer the question, so what, and bring the discussion to the next level for these articles that are being published and are so influential for our field.
Wow, that is awesome. I'm not only really happy that you're able to, set the goal and accomplishment, but it sounds like those opportunities are really something that's bringing you to the next level. That is awesome.
I can probably jump in next. I definitely have always been someone that's been fascinated by the publication process. So when I saw the announcement, I was really excited. I didn't necessarily know what to expect, but I just thought I would learn a lot from the current editors, the editor, Dr. Ruth Carlos, and deputy editor Christoph Lee. So I really wanted to see like what happens once I joined the program. I was just fascinated to see the back end of the process. I've published articles before, but really didn't understand, what happens when articles are submitted, how is it processed, how are decisions made, and really the technical aspects of that. So it was great to be able to understand that and how editors actually make decisions and strategize to really try to grow the journal. I also, during the fellowship went to, it was nice to go to Virginia to the home office of the ACR, and then to go to New York to actually, visit the publisher and have just these important meetings to see like, what they're looking at and also like how they're looking to grow the scope of the journal. In terms of what I got from the journal, I got a lot of exposure to the process, which I wanted, but I was also able to start a webinar focused on a topic that I felt, wasn't necessarily highlighted as much as it should be. So it was really exciting for me to be able to propose this topic and have the journal support it. So I started a webinar that focused on issues faced by community and safety net environments, really trying to get the perspective out of, many of these doctors who are practicing in the community who may not have time to, publish articles. So to really create a community where doctors practicing these settings can learn from each other, but also show what's worked in their specific settings.
Wow, that's amazing. I mean, not only did you get insight into the black box that is, the publishing zeitgeist, but were afforded the opportunity to start your own webinar series and help outreach in kind of those areas of care that matter the most to you. That's really great. We can move on to the next question. So for residents and fellows who are early on in their careers, what are some of the most effective ways to start engaging with the JACR? Are there specific opportunities for contribution that might be more accessible for those just starting off in the field?
I'll start with this one again. I'm going to start to sound like a broken record here, but I think the first step for sure is to apply for the Trainee Editorial Board. I know that the application deadline was recently extended to December 31st. So again, that was my first experience with everything, and it was a big stepping stone towards this and getting more involved in the JACR. You can volunteer to become a reviewer. You may feel uncomfortable doing that, being so early on in your career, but you can learn how to do it. I'm even happy to help anybody who wants to learn about how to review articles. I'm willing to work with anybody on that. I would say also monitoring all the social media feeds, which is basically a full-time job in and of itself because of how many resources we have on Twitter, LinkedIn, all of our webinar series, everything like that. Just making sure to keep up to date with that, get all the email notifications, know what's going on. And then another thing is that there are many special issues of the journal which may hit on a topic that you like. You can try to work towards submitting an editorial or a project or an article on anything that you find interesting for a special issue journal, or just anything in general that you'd like to submit. So I would highly encourage trying to get involved with all of those steps, which would really help.
Yeah,
that's awesome. Oh, sorry. Go ahead, please.
I was just going to emphasize just the JACR Trainee Editorial Board. I think it's a great experience. Experience I wish I could have experienced when I was a trainee, because the Trainee Editorial Board, they'll help mentor you in terms of how to do a peer review. I mean, you have these like interesting like small group lectures and just some other activities that really help you understand the scholarly process. I think that's a great entryway. I'm also talking to mentors who, publish in JACR, just getting their perspective on the publication process, and, maybe seeing if they have opportunities to, help them with their papers, or if they have connections with the JACR that could potentially help you become more involved.
Yeah, and I'll just piggyback on that. So, the JACR Editorial Board is a really great place to start. I think that's not going to be the end of the journal. I think that, we have bigger aspirations when it comes to trainees. We are placing quite an emphasis now on pipeline creation, really training the future generation to know how to review an article, to know how to write a manuscript, to know how to submit a manuscript. And so the Trainee Editorial Board is the start. I think our hope is in the future that we can start piloting sort of a version of the Trainee Editorial Board at institutions where we see interest, a lot of interest with trainees at certain institutions. So I think that that's something that could really be a reality in the future. We've talked about it at prior editorial board retreats. And so that's, something that I do think we can strive for. I think that Dr. Miles gives, really good advice that there are a lot of us who do write manuscripts for the journal, and we do collaborate with trainees. I just submitted something with an attending radiologist and a medical student who is first author. So we're all willing to help you if you are interested in submitting something. And then also, and we'll talk about a little bit of this down the, a little ways, down the line here in this webinar, but with the digital media efforts, we do have a social media working group. And this working group is essentially a think tank of ideas where we basically all come together and come up with a lot of digital media ideas and efforts for the journal. We also have our working group members, one of their responsibilities is to help us disseminate, our content on our social media platforms, particularly on X, formerly known as Twitter. We're really expanding our Instagram presence. We're now on LinkedIn. Working towards being on Blue Sky. So having trainees on our social media working group has been really fantastic and a way for you to contribute early on. So there's a lot of opportunities in which to get involved. And I would just echo everyone's sentiments. I think the earlier you can get involved, the better.
That's awesome. Really everyone has to start somewhere, right? And the Trainee Editorial Board sounds like a great place. Awesome. So, Dr. Patel, you currently serve as a part of the JACR's editorial board. How did you originally get involved with the JACR? Can you speak on your journey to get where you are today?
Sure. So it happened fairly organically. So, I surprisingly was not really that avidly active on social media until I was on the executive committee of the ACR-RFS back in, I think, 2015. I'm like dating myself now, but we were all required at the time to create a Twitter account. And I was thinking, this is so ridiculous, but I did it because I was on the executive committee. And then I became addicted. I became a Twitteraholic. And from there, I just got really immersed in the world of social media and platforms. And it just kind of took off from there. I started helping with the social media accounts for the ACR advocacy branch, and then in addition to all the digital media stuff I was doing and kind of getting myself out there more and more with all the digital media or the social media efforts that I was carrying out, I started to publish more and more in the journal. I mean, I just had an interest in it, and publishing from columns to any kind of manuscript, collaborating with attendings. Again, had some great mentors along the way. I mean, I still remember some of my, couple articles that I published as a trainee, and I was first author with great mentors like Richard Duzak, Elizabeth Arleo. So, so having these mentors early on helped to really propel me to publish. So very unexpectedly, though, I believe it was 2018, I got a call from Ruth Carlos, and it was kind of out of left field. And she's like, I want to expand the journal. She had just come on as the editor-in-chief, taking over from the Titan Dr. Bruce Hillman. And she said, I really want to be the first journal, not just in radiology, but the House of Medicine, where we're known as the go-tos for digital media. I want us to stake that claim. And I think you'd be a good person to help us with that. And I'm thinking to myself, I know social media, but, I know there are people that publish way more than me. I'm obviously early in my career, but, the great thing about Dr. Carlos or Ruth is she's very supportive of trainees, of young radiologists. I mean, she's just an awesome mentor for me. I can't sing her praises enough. And she's like, no, like, you're the right person for this. Like, I'm going to give you freedom to fly, which she still has. I mean, she's very much lets kind of us fly with things, which is really awesome of her. Let's experiment with things, see what works, what doesn't. And that was it. So we've been really fortunate, to expand our efforts over the years, even with the challenges of, that everyone faces right now in healthcare, whether it's budgetary issues, whether it was COVID. I mean, we've had challenges. We had a little staff turnover, but even amidst all that, we've had really great successes, and we've been able to expand the journal to what it is now when it comes to the digital media landscape. From Randy's case series to, we previously had a podcast, and now Maddie's resurrected the podcast, to our website is just so much better than it was before. All the platforms we're on, how we're expanding our presence. We also have virtual journal clubs. So we're just continuing to expand our efforts. And I couldn't be more proud of, we started at literally ground zero, nothing. And now, in soon to be 2025, we've really been able to expand our presence and our brand. So I'm really, happy about that, but it just, really happened organically. And I think that for any of the, if you are somebody who strives to be an associate editor, because if you look at the journal, you'll see all the associate editors and like what they are in charge of. So there's, early career and leadership, it's important for, if you are, have interest in that, you got to publish in the journal. And, it doesn't hurt to even reach out to Dr. Carlos and say, or Dr. Christoph Lee, who's the deputy editor, and he's amazing too, and say, this is a goal of mine in the future. Like, what can I do to kind of strengthen my chances of potentially assuming this position in the future, working myself up to that. And they'll give you some really great advice. We do more, though, than also like what our role entails. So there is more work involved. For example, we are encouraged to continue to publish. So we, and it doesn't necessarily have to be in what you cover. So like, I don't have to publish everything in digital media, but we are encouraged to continue to publish, to be reviewers. We also every year have to give a number of potential reviewers, to Ruth and to Christoph to contact to help us review. So one of our roles is to try to find new reviewers, which has been very difficult, post-pandemic. There's the reviewers, the number has really gone down, just like publishing has. So we are tasked to do other things in addition to what our roles are. But overall, these positions that we end up getting asked to do are very organic. And I think that a lot of the other associate editors would say the same. It sort of happened in an organic fashion, and just kind of fitting the bill in regards to what they're an associate editor for, content-wise.
Excellent. Thank you so much for sharing your story. It's really inspiring, especially to a lot of the residents and fellows out there who are just now getting started. That's wonderful. So to switch gears a little bit, for people interested in publishing with JACR, what types of research are most likely to catch the attention of the journal's editors and reviewers? What's hot right now?
So do you want me to take that one? I can start.
Sure. Yeah, please.
Yeah. So the journal really prides itself on cutting edge innovation, but also at the same time practicality. So some of the the manuscripts that do really well in the journal, you know, anything from cutting edge research when it comes to like artificial intelligence, we know is just it's a hot topic. It continues to be a hot topic. You know, whether or not you know, you want to argue about the, you know, the slowness of adoption, there's still a lot of interest in AI. So that's definitely a hot topic there. But then even just practical, you know, manuscripts on, you know, on leadership. You know, we have a leader, you know, we have an associate editor that specifically focuses on the content of leadership. I think leadership, practice management. JACR has historically been that journal go-to for these sort of practical, this practical content, operational content. They've been the go-to. So we look for that definitely. And then also, you know, JACR is the go-to when it comes to you know, practice management clinically. So practice parameters. Whenever surveys are conducted in the American College of Radiology, they typically, the findings get published in the JACR. So that kind of content is very of interest to our readership. But also, you know, I would say that if you have an idea, then maybe you're like, I look through these journals and I don't really see this kind of content. I don't even know if they'd be interested. It never hurts to email Dr. Carlos or Dr. Lee or both of them and ask them and just pitch it to them. In the past, I mean, I've pitched stuff to Ruth and I've said like, hey, I want to write, you know, about this. Like, what do you think? And then she'll email me back and say, okay, I like the concept. What if you did like this spin on it? And then, you know, it has a better chance of being accepted. So, I mean, you know, have that luxury of asking, or, you know, like, let's say you want to write a manuscript on leadership. You can contact the associate editor that handles that and pitch that idea to them. Even though I'm you know, for digital media, and I've had people reach out to me about, you know, pitching manuscripts for that, you know, I will have like, you know, in the past, historically, like young radiologists contact me, even though, well, now we have an early career column, but early on we didn't. And they'd say, hey, like, I want to publish this, like, you know, do you think it would be of interest? And so I'd contact Ruth and say, you know, hey, should we publish this? So, so that's kind of, you know, in a nutshell, you know, you can really pitch whatever you want. There are these, you know, core things that I think are hot right now, but really if there's something that you think should get published or is a good idea, like, you've got to pitch it to the JACR, because they're going to be open about it and give you good feedback whether or not it's something that the journal would be interested in publishing.
Yeah, just to follow up on what Amy is saying, the breadth of articles published in JACR is vast. You know, I think the journal is just really interested in, you know, publishing on timely, pertinent, and just important topics that impact radiologists. And you know, there's so many different areas that fit that bill. Obviously, there's a lot that's published on health policy and clinical practice, but you know, there are a fair amount of like articles on education, like Amy was saying, leadership. So, I mean, I think if you kind of start with what your interests are, and if it's an important topic to you, getting that guidance, whether it's from, you know, Christoph and Ruth, our editors, or other mentors that have published in JACR, they really can help you craft something that probably others are going to find very fascinating as well. I think one of the best things about the journals is that it appeals to a wide audience, not just, you know, academic radiologists, but, you know, community radiologists, private practice radiologists, and, you know, there are radiologists from all these backgrounds that are also publishing in the journal. So it really does help provide information that's helpful for a wide array of practices.
And, you know, historically, the journal was kind of geared towards more, I would say, private practice kind of content. And over the years, I think it's really refined to represent a quite diverse mixture that, as, you know, Randy alludes to, appeals to all practice types. And I think that is a huge strength of the JACR that sets it apart from a lot of the other radiology journals, because it appeals to all practice types. It's quite unique in that regard.
Thank you so much for that excellent advice. I think you know, that's something that people who are interested in publishing can really take to heart. So Could you speak to the impact that publishing in the JACR has had on your career, and how might it benefit a resident or fellow's career trajectory in radiology?
I can start with this one. I think, you know, publishing in reputable journals is can be very helpful, very important in terms of moving to the next step of your career. I think in terms of if you're like a trainee, being able to, you know, be a part of some of these articles can make you a more competitive candidate to get to the next step. But I think one of the most exciting things is just, you know, really researching something that you're passionate about, researching something that, you know, can also impact, you know, others, you know, when they read it. You know, there's so many articles that I read as you know, a leader of my division where I'm like, oh, I never tried that. And that's something that I can use to implement in my clinic that can really change the lives of patients. So to be able to publish and be a part of that process, I think is very exciting. And I also think, like, you know, starting to publish early, it kind of helps you to kind of start thinking about your interests and kind of get you on that fast track to, you know, getting on a road that is, you know, getting on a road and understanding where you want to be for your career. You know, and once you do finish and you're an attending, you know, these articles can be used for promotion. They also can be used to help, you know, like qualify you for leadership positions and all of that. But I think it's more about the topic and, you know, really exploring that, you know, and then secondarily, some of the ways that, you know, publishing a lot can help you in terms of your career. So.
And I'd like to add one thing that Amy had mentioned earlier was the opportunity for trainees and other faculty to collaborate across institutions on issues and areas of interest that they have in common. And that might not be something that you would be able to do otherwise, or collaborate thoughts and the think tank of ideas. So it's another sort of space to be able to do that, especially as a trainee, and to get that mentorship early on.
Yeah, and I think, you know, for me, it opened a lot of doors. You know, it helped, you know, if you have a lot more publications, you're more likely to be promoted. So, you know, I was able to be promoted to an associate professor. So, and at the first chance I could at my institution. So, you know, I'm pretty young to be an associate professor, but a lot of that is because I published a lot. So that helps. That helped in that regard. You know, once I, you know, assumed this position and was kind of known as digital media, social media kind of person, I tend to give talks around the country, and I got asked to give a lot of talks. And then from there, it opened up the door for me to be on the RLI Speakers Bureau. And so a lot of times, like, state radiological societies will request my social media talks. So it really can open a lot of doors, getting involved in the journal early. And depending on what you are interested in, there really is a pathway, and it can really just stem from being involved in the journal more than you would think. I mean, I'm very, now, you know, looking back, I can't believe how my career sort of pivoted in certain ways, and I know wouldn't have without being involved in the journal.
That's really valuable insight. Thank you all for sharing. And I think a lot of people who may be at a crossroads with the direction that they may want their careers to go in can take that to heart and think about what the JACR publication and involvement can do for them in their future, their careers. So switching gears a little bit, how does the JACR support diversity in radiology research and writing? What advice would you give to resident and fellows from underrepresented backgrounds to ensure their voices and perspectives are included in academic radiology?
I can start. You know, I think JACR, just due to the breadth of topics that are covered in the journal, you know, I think this is one of those areas that I think the JACR does a great job of covering in just in different areas of you know, diversity. I will say that it's very important, especially if you're coming from a background or if you have a perspective that you think is not being covered, to, really try to make sure it does get highlighted, especially if you feel it's an important topic. So, if you do, if there is a topic that you think needs to be covered and you think the JACR audience would benefit from it, I think some things that I would recommend is to reach out to, like Amy has mentioned before, like Ruth, Christoph, see if they would be interested. I think also you can reach out to mentors, and especially someone that's experienced with writing and especially publishing in the JACR, and get their insight and see if potentially, you could write something up under their guidance, and see if they can help you with the technical aspects of it to make sure that that work can get out. I mean, just for an example, there was a college student that I worked with, and he was interested in writing about gaps, about disparities in care in Asian and Asian American women, and relating that to breast cancer disparities, and really exploring that topic. And that's something where, I was really passionate about it, and something that I was like, this is an important topic. So it was something for me, I was able to help him to kind of navigate that process. And, we were able to submit that article to the JACR, and, it was published, and we were able to kind of highlight a topic that, that we felt maybe was not getting as much, attention. So I think these are ways you can really get out information on topics that in diverse areas that may not be highlighted as much, just by reaching out to mentors and JACR editorial leadership.
What's really cool is that the JACR, if we go to their website and we're able to log in, we can see that there's actually a filter for diversity, and it's called Diversity Matters. And it brings up all the diversity content that the JACR highlights. And I would highly recommend all of us, to take some time to look at the Diversity Matters content in the JACR.
Awesome. That is excellent. Thank you so much for sharing those anecdotes and the perspectives. It's really nice to know that the JACR helps ensure that all voices are heard. So speaking a little bit more on the topic of mentors, for those looking to expand their professional network, how can involvement with the JACR help resident and fellows connect with influential mentors, collaborators, and leaders in the radiology community? What steps would you recommend for fostering these connections through the journal itself?
I'll briefly touch on this. I think we kind of covered this a good bit already. But again, just kind of building those mentorship opportunities, emailing any of the editors. If you need to bounce off an idea off someone, email someone. It's a collaborative effort. It's the experience. We all support each other here at the journal, and we're all pretty nice people. And I'm willing to help anybody who's interested in the Hillman Fellowship. You're more than welcome to email me. I'm a pretty nice person, unless I'm hangry or something. But other than that, I'm willing to work with anybody and help anybody I can that is interested in getting more involved in the journal.
Yeah, it might seem a little bit intimidating, but I think that, just even if you don't know who they are, emailing one of the associate or assistant editors and just saying, who you are, maybe, meet virtually, what you're interested in, basically throw out there that you would be interested in potentially collaborating. I think that most of our, I'm biased, but I think most of our associate and assistant editors are very, very friendly. They're very approachable, and they just want to help. All of them are very committed to lifelong learning and for pipeline creation. Again, Ruth's built this really great culture of bringing up the next generation. And so I think that from those connections, it can help, and meeting up with these people at meetings, I think it can be a great networking opportunity as well, particularly at the ACR annual meeting. JACR, we have, a booth and content, and going there and meeting the team, is important. Meeting people at RSNA, we're usually there too. A lot of us who are a part of the journal. So just those sort of opportunities, again, can be a little bit uncomfortable if that's kind of out of your comfort zone, but it can pay huge dividends if you can create the connections with these leaders of the journal who really want to see you succeed in your careers.
Yeah, and don't be afraid to, send a second email. A lot of times, we get a lot of on this, webinar, we get a lot of emails, but and sometimes, if you don't get a response, don't necessarily think someone's like ignoring you. Give it a week or two. If you haven't heard a response, maybe give a follow-up email. Don't be afraid to, send a direct message on, on X. I really do like the assertion of, going and, if someone gives a talk or if you see them at a conference, to, approach them. I think that's a perfect time. They're at a conference, they're, not at work, it's a perfect time to engage and to, really talk about, topics related to either the journal or some of your goals and see if you can make a connection.
Yeah, that is a very valuable insight. I think it is a very pleasant surprise for a lot of radiology residents once they enter the community to find out just how supportive of a field it is through and through. Not to throw shade at any other subspecialty, but I like to think we have one of the better communities. Excellent. So publishing in a respected journal like the JACR, can seem intimidating to many residents and fellows. What are some common challenges or misconceptions that you see among early career radiologists, residents and fellows when it comes to submitting to an academic journal such as this, and how best can they overcome the hurdles?
I think that, and I'm speaking to this because I was sort of in those shoes in the beginning. I'm like, oh my gosh, candidly, I did my residency at a program, which was awesome, but the attendees didn't really publish a lot. And I was like, I don't know how to do this. Like, this seems very daunting. Like, how am I going to publish a scientific review article? But, my advice would be if you don't come from an institution that's like prolific in publishing, being a publishing machine, like an MGH or something like that, you can start small. There are, short editorials that you can write in the journal that are much less intimidating. Just kind of get your feet wet and build from there. There's different kinds of articles. So you could just start small and then move up. And then over time, as you build your mentors and your network, you can then start getting into sort of the more in-depth articles. So the opinion pieces are also, low-hanging fruit, easier publishable opportunities. So don't think your first one has to be this like 20-page, 24-page scientific review article. There's just other opportunities in the journal where you can kind of start small and build, and it doesn't seem as daunting as starting with something that's really large.
Similar to Amy, I had this misconception that you had to have like these randomized controlled trials with huge sample sizes and national-wide things, and it's just not the case anymore. You can do a case study. There's a really interesting one that I just did a podcast episode about UNC Chapel Hill and how they did a virtual multidisciplinary tumor board with Malawi, and it was just a very simple article detailing what they did. And it was very instrumental in what they do in Malawi. And it was just very interesting. So it doesn't have to be something complicated with statistics and things like that. So, you can always keep it very simple, but just yet still very innovative.
No, I'd like to echo those points. And, I think one of the intimidating factors is just thinking about ideas for articles. And I think after a while, things just start, after you have more experience, I think those things start coming natural. You just start thinking about, what issues am I dealing with in day-to-day practice, and more than likely there's other people that are dealing with those same issues, or, is there something that you're encountering that you haven't seen an article on or whatever else? That's a great place to start to think about, like, well, maybe, others would benefit from, like research in this area, or like I stated earlier, like an opinion piece. So, just even starting there. I think collaboration is something to pursue as well if you are looking to, publish in the journal and you don't have much experience writing. Talking to authors who publish in an area that you're interested in. And there's always ways to help. You can always, you can always offer to, do the literature search, or you can offer to, try to to write the first draft with guidance, or, work on aspects of the article to help just really split some of the work. So, don't be afraid to reach out, to collaborate with authors from other institutions. Most of the time, when someone is working on a journal article or a paper, they could utilize that help, whether it's at the, beginning, looking at a literature search, or potentially just like fleshing out ideas where, as either a trainee or a radiologist, as a junior attending radiologist, you do have perspective that, potentially could add to some of these topics, whether it's like the stage of your career, whether it's where you practice, or, just kind of what you've seen practicing in your early careers.
The other thing that I'd love to highlight is the JACR actually has a section on the website called Call for Papers. And a lot of times you can go there and see which guest editors and which editors are putting out call for papers related to a specific topic of interest or several topics of interest. And that can be another way for you to explore your interests and see what the journal is looking for. Because as my team here mentioned, it's sometimes challenging to brainstorm topics. And so it's good to know what does the community want to know about.
And also, even if you're, so like a great example, even if you're participating, let's say, in a webinar that you might think is interesting or something like that, write it up. So, recently Randy, myself, and a breast imager at MD Anderson, we just participated in an RSNA breast health equity panel in October. And we're taking our content from that and we're going to publish a manuscript in the JACR. So that collaboration, like Randy talks about, super key. And, sometimes you don't have to reinvent the wheel. You've already done a lot of work. It might be in a different fashion, like a webinar, but you can take that work and publish it. And so especially if you think it might be something that would be of interest to readers. So that's another way you can think about, kind of overcoming any sort of challenge might seem daunting in publishing. Think about stuff that you're just doing already that would be, potentially somewhat easy to write up.
No, definitely. Don't be hard on yourself. I think everyone's kind of experienced that, but I think trust us. I think like even Amy and I will have conversations where we're like, oh, someone should write that up, or we'll be talking about a topic. It's just like someone should write it up because you're probably focusing on something else. But some of these ideas, after you've been practicing for a while, just come natural. So it just kind of comes with just more experience and more experience in practice. So don't feel like it'll never come, because eventually it will.
That is really excellent advice. Thank you. Thank you all so much for sharing. And as Abby noted in the chat, we are now accepting content proposals for a special issue on cybersecurity. For anybody listening in, I think there's lots of great opportunities in there, especially in the wake of the CrowdStrike IT disaster that happened earlier this year, where everyone's computers all the reading rooms turned into seas of blue screens. I'm sure everyone remembers that fondly. Well, great. Thank you all so much. Anyone in the audience or in the chat who wants to ask any further questions, please feel free to go ahead and drop them down. But as of right now, that's all the questions that I have for our wonderful panelists. So I thank you all so much for taking the time to answer the questions tonight. And Dr. Leahy has a presentation for us about some changes and some interesting movement in the JACR this year.
Thank you so much. On behalf of the ACR Resident Fellow section, I truly want to thank all of you, our panelists, Dr. Miles, Dr. Patel, Dr. Wolfeck, and our moderator, Dr. Jeppa, for the insightful discussion and meaningful advice for our audience this evening. I would also like to thank Abby Faulkner from the ACR for helping the ACR-RFS and the JACR host this collaboration. We truly appreciate everything that you do for us. So to conclude our program today, I would like to share a few slides that highlight trainee opportunities with the JACR, and some of which we've discussed this evening. So the first slide really shows one of the biggest, I think, barriers for people to get involved with the JACR is not know actually that it's free for all members of the ACR. And to remind our group here, if you are a medical student in the US or Canada, a resident or fellow, then your membership to the ACR is free. And part of that membership means that you have access to the JACR for free as well. You might wonder, how do I access the JACR with my ACR membership? Well, actually, you have a single sign-in. So your ACR login will suffice for your login to the JACR. And there's a screenshot of what that should look like on the slide. Next slide, please. The other big news from the JACR team that we'd love to share with the audience today is that we're going online only. And it's a really great initiative for us to have quicker article releases, digital extras, and more sustainable publishing model. So that should be next month. Next slide. What we've actually talked about several of these areas of focus. So the JACR has 5 pillars that they like to focus on, that we like to focus on. And it's nice to take a moment to cover again what those are. So data science, training and education, leadership, practice management, and health services research and policy. And so under the umbrella of these 5 pillars, you'll often find various subtopics and articles being published. I'd also like to highlight that a lot of the topics that are covered in the JACR, including those 5 pillars, are ones that residents and fellows, including myself, may not have been exposed to in training. And I think that that's one of the things that makes the JACR so unique, is we cover a lot of non-clinical areas that help us become great radiologists in practice, whether it's in private practice or in academics. Thank you. Next slide. We also have a newsletter. So it's a monthly newsletter that gets released when the new edition drops, and you'll be able to stay up to date with JACR announcements. If you're interested in signing up for the newsletter, you'll just have to log into your ACR account. You go to My ACR, and then you hit My Communication Preferences. And you'll notice that you'll be able to sign up for other newsletters as well. Just a plug for our advocacy newsletter. I know Dr. Patel is on the call as well. And so that's, you know, another opportunity to stay up to date with a lot of the ACR news content. Next slide. We also have a robust social media presence on X, YouTube, and LinkedIn. So follow us there. And as Dr. Patel was mentioning, you know, expansion onto other social media platforms as well. Next slide. So the 2 main, you know, applications that are open at this time, which is one of the reasons we're really excited to time our webinar for now, is the JACR Trainee Editorial Board. Dr. Wolfak participated in this, and as she mentioned, she'd be happy to answer any questions offline as well. The application closes at the end of the month, and it's a really great, you know, opportunity for trainees to learn about peer review in a mentored setting, to get small group lectures and get a behind the scenes look at the JACR. Next slide. Another opportunity is the Hillman Fellowship. This opportunity is currently open as well. You could speak to Dr. Miles, myself, or Dr. Wolfak as Hillman Fellows. And it's also open to early career radiologists as well. And so it's a little different in that you'll be able to complete your own project related to the journal, and you'll have a 1-year appointment to the editorial board. Next slide. The last sort of piece that I would love to share on behalf of the ACR-RFS is for anyone who's interested, again, in volunteerism, in leadership, we have our call for nominations that is currently open. Dr. Patel spoke about how her actual involvement in social media stemmed from her leadership in the executive committee of the resident fellow section. And the opportunity to join the resident fellow section is currently open now to submit your nomination, and it gets reviewed by the nominations committee. So that application is also open till the end of this month, and you can simply Google ACR-RFS volunteer, and it'll be the first link that shows up. That's it from us. We're really grateful for everyone participating and tuning in to our webinar. We're excited that we get to, again, highlight opportunities for trainees specifically, and encourage everyone to get involved with the JACR and the ACR-RFS. Feel free to reach out to any of us. I speak on behalf of the group if you have any further questions, or if you want to get involved with the JACR or any of the initiatives that we spoke of this evening. Thank you so much. Have a great evening, everyone.
Excellent. Thank you.
Thank you.